Hello everybody. Today we're going to talk about treating cancer in Africa. In 2018, over 1 million new cases of cancer were declared on the African continent. And with many cases likely going undiagnosed or unreported, the actual number may well be higher. In order to talk about this matter, I've come to Henri Mondor Hospital in suburban Paris, where many cancer patients come for treatment. Tackling cancer in high-income countries with a solid healthcare system is based on prevention and early diagnosis, via awareness campaigns and routine screenings for people at risk. Actions like these make it possible to start treating patients in the early stages of the disease, increasing their chances of recovery. Once diagnosed, a case of cancer requires a coordinated effort of a multidisciplinary team and the right technical infrastructure. The African continent is going through an epidemiological transition, which means that the number of deaths associated with cardiovascular disease and cancer is on the rise compared to deaths associated with infectious disease. This transition is linked, among other things, with the fact that people are living longer and that their exposure to risk factors such as physical inactivity, smoking and alcohol is also on the rise. The three most common types of cancer in Africa are cervical cancer, breast cancer and prostate cancer, and their consequences can be devastating. For example, the survival rate for breast cancer at 5 years, which is 85% in resource-rich countries, doesn't exceed 15% in Africa. I am now in Queen Elizabeth Central Hospital in Blantyre, Malawi, where MSF offers a comprehensive cervical cancer treatment program. Cervical cancer affects the lower part of the uterus and is caused by a virus called human papilloma virus. If a woman infected by the virus is also positive to HIV, which happens frequently in this area, the chances of the infection turning into cancer are higher. As a result, over 2,000 women die from cervical cancer each year in Malawi, a disease that is both preventable and treatable with success if diagnosed early enough.
Most of the people living in the rural areas are living below $1 per day. So it is also a challenge because for them to travel to the health centers, it is not less than 3,000 kwacha, which is quite a lot of money. The government hospitals, they are told that they have to pay at least 20,000 kwacha for the biopsy, which is also a challenge. So even other women who were to be treated and to be cured did not get the services because they did not have money to do the biopsy.
I am now in a health centre near Blantyre. Women come here for screening for cervical cancer. But even in this area, near one of the major cities in the countries, access to screening is not easy. And sometimes, if found positive, they have no options for treatment.
This morning we went to Ndirande to see Margaret Mafuba, who is 49 years old. She had been to the health facility to be screened for cervical cancer way back in 2017, and she was told that she was negative. And she kept on, the symptoms kept on persisting, and she kept on going to the health facility in order to be given medications for STIs. It was now in 2019 when she discovered that there was a screening center for MSF at Ndirande, where she was now detected as a cancer suspect. And when she was told to come to MSF outpatient department, then they examined her only to discover that she was already 3B and on palliative. It is something so pathetic because this woman had the eager to know how she was doing and only to realize that she was indeed a cancer suspect at a later stage.
kuti timakhazika pa mpando ndikumasambisa koma kuti adzuke pa mpando pa okha abwere panopa alowe nyumba moka ndipo ndizikukanika koma zina ndi zinazo zachepa.
Mujalozizira tabena lidentesi. Más o menos muone me da monteza.
As was the case with AIDS at the end of the 90s, our teams are sometimes not fully equipped yet to assist patients severely ill with cancer. A major challenge for the next decade will be to improve the way we tackle a very complex disease requiring specific resources and skill sets in areas of the world lacking adequate levels of infrastructure and experience, but where needs are growing fast.